Right, so the study really randomized patients head-to-head between the two regimens, and the NALIRIFOX regimen was associated with a higher response rate and a better progression-free survival, and an improved overall survival compared to Nab-Paclitaxel in that study. Yeah, it's a good question. I think that, when you look at 3 drugs versus 2 drugs, the hypothesis was going in that with a little more chemo, we might be able to help patients live a little longer, which has been the supposition based on some other studies. Prior to this one, there really hadn't been a head-to-head study with a, in this context. So, that was the main purpose of the study, and that's the question that we sought to answer. We are probably dealing with 2 very different toxicity portfolios. One is going to be heavy on the GI toxicity, more commonly seen GI toxicity, diarrhea, upset stomach, and sometimes constipation in the NALIRIFOX, versus a little more blood count changes in the Gem-Nab-Pac. So, and a little more neuropathy in the Gem-Nab-Pac as well. Or I should say the neuropathy wasn't altogether too different between the studies, but those were the main findings on toxicity differences. That's a good question. I don't know if, the next step is, number one, it just received FDA approval, which is sort of a big milestone. Now the next step are going to be to analyze the existing patients to see if there were some biomarkers or something of interest in that group of patients we might be able to learn a little more about. I really do value that. Secondarily, I think, I look at it as something to build on. So for example, the next study, hopefully, will combine something else or some derivative thereof, looking at adding new drugs or biomarker select drugs to some of these categories. So, or to some of these backbones, I should say. So, yeah, I just, the way I've always looked at it is, hey, it's just one study, and, I'm glad that we got here, but we got to move on and try to improve outcomes for the future. And so that's kind of the way we look at it. It's too early to say. We've got a lot of interesting, provocative drugs ongoing at this time in phase 1 or phase 2 trials for pancreatic cancer. So, some of them are being reproduced to make sure that we're not barking up the wrong tree. But a lot of them have, I think, a sufficient amount of patients and some good data to be optimistic that, we should be moving forward with some of these drug combinations. And that's kind of what we're looking forward to doing the next few years. Adding to or substituting, depending on the context, in patients with this terrible disease.